On the Medical Watch, Lurie Children's Hospital is celebrating a record number of pediatric transplants in the past 12 months. The hospital performed 140 transplants, and there's no signs they're slowing down. Dr. Philip Thrush is the medical director of heart failure and the heart transplant program at Lurie Children's Hospital, and Dr. Michael Mange is the surgical director. They join us now live. Thanks for being with us.
No, thank you for having us on. This is an absolute pleasure, and it's an exciting time here.
Something good to talk about. Yeah, so what's the reason, do you think, behind the rising numbers of transplants? Is it like there are more sick kids in need, or are people just seeking that procedure at Lurie?
I think the reality is we have really robust solid organ and stem cell transplant programs at Lurie, and we have a lot of experience doing this. You know, the kidney transplant program has been transplanting for over 60 years and has over 800 kidney transplants, and the heart transplant program has done more than 450 heart transplants since the late 80s. And I think in the setting of that, Lurie has gained this reputation as a transplant center of excellence. And we have a wealth of experience to take care of really complicated patients. And so with that, we certainly have seen a rise in the number of patients that are coming to Lurie from other states and other programs.
Dr. Mange, can you give us a sense of some of the kids who have benefited? I don't know if there's a story or two that really stick in your mind.
So over the last year, we've performed 30 transplants. So it's been great to give these families hope and benefit all these children. They've ranged from very small neonates and infants all the way up to older children with either congenital heart disease or cardiomyopathies that have developed over time. So it's been a wide range and heterogeneous group of patients and medical complexities.
You know, when we think of a kidney or heart transplant on a young child, it just seems like such a fragile process. Are outcomes improving with the increase in the number of procedures you all are doing?
The outcomes at Lurie Children's are phenomenal across all of the organ transplants and stem cell transplants. And I think there's a lot to be said for the volume of transplant that you do and the outcomes that you get from that. And I don't think it's about being the biggest or the busiest transplant center. It's about having those excellent outcomes. And I think it's that volume that we do that leads to the experience and expertise to have the outcomes that we get.
And so as you guys look back at a very busy year, and I know just the last few months have been extremely busy in the transplant department there, tell me a little bit about just how it's changed since both you all started doing this, because I would think just the outcomes, the procedures themselves, especially with such a fragile patient group, has had to be remarkable.
So Lurie Children's Hospital performed the first transplant back in 1987, and as we come up upon 40 years and nearly 500 transplants, close to 300 of those have been performed in the last 10 years when Dr. Thrush and I have been there. And these transplants have been performed in increasingly complex patients, either with complex congenital heart disease undergoing multiple prior operations prior to transplant, or coming in, and a large percentage of our patients are now going to transplant with ventricular assist devices. We have one of the larger ventricular assist device programs in the country, and that's allowed us to support these patients prior to transplant and give these families hope as they wait for a heart to become available, and allow these children to be up walking around with their organs and other organs in good shape going into transplant. So the complexity has increased.
We're seeing some of the kids and families who have benefited. Doctors Thrush and Mange, thank you so much for joining us. We appreciate it.
Appreciate it. Thank you very much.
Thank you so much.